Here's an example of treatment of piriformis syndrome, which is that pain in the back of the hip that kind of comes down the back of the thigh, almost to the knee. The pain is typically a dull, achy pain, even maybe a numbness and tingling coming down the back of the thigh. They may have pain when sitting for a long period of time, such as a car ride. They'll get that pain in the back of the hip, kind of coming down the leg, maybe have trouble crossing their legs. They may also have pain sleeping on their side. The sciatic nerve runs right alongside that piriformis, kind of down the back of the leg, and even some people can go pierce through the piriformis, and that can cause some of those symptoms. So you're going to take like a tennis ball, a hockey ball. Really, you're trying to target this area in the middle of the glute, like in the middle. You'll feel your sacrum, this bony landmark, and out here is the greater trochanter of your femur. So you're in between those two landmarks, so right in the middle of that glute. You're going to try to line up that tennis ball or hockey ball or some firm ball, and then you're going to lean against the wall until you feel a good firm pressure, and then you can roll up and down. You can go side to side, really trying to find that painful spot that's contributing and kind of recreating some of that pain or symptoms down the back of the thigh. Now we'll do a couple stretches to try and target that area. So laying back, so you're going to bring your leg up onto your other leg in like a figure 4 position. And there's a couple ways to do it. You can either grab your knee, pull it toward your opposite shoulder. You should feel that in the back of that hip there. Or you can reach through your legs and grab your other knee and pull toward you. Holding for 30 seconds at a time. Or you can also, another variation, is pushing the knee away and pulling the ankle toward you. Now we need to do some strengthening. So we're going to strengthen some external rotators as well as the abductors in the hip. And we want to do this on both sides. So we're going to do a side plank down on this knee, a nice high plank, and then you're going to do a clam, opening hips up like this. So really this is tougher on the leg that's on the bottom to do that side plank. Doing 10 at a time. And then you're going to switch into the other side. And then we're going to do hip abduction, so a little bit more of the glute medius, so legs nice and straight, nice straight line, lifting up toward the ceiling, and then slow and controlled is really the key. So strengthening these hip abductors and the external rotators are going to help to improve the stability in that area and around the pelvis and the SI joint to hopefully relieve some of the tension of those muscles and then relieve some of the stress on that sciatic nerve. Now you want to take a band, put it around could be around your ankles or it could be around your knees. I'll put it around my knees so I can show you 2 back to back. So you're going to do a little bit of a squat, keep that squat, and then you're trying to keep this band tension on it the whole time. So sidestepping, back and forth, really working. You're going to feel that in your hips as you do it. And then after that, keep that tension again. You can do it above the knee or slightly below the knee for this one. So pulling the tension, and then you're going to do a squat. Hold it for a few seconds, come up slowly, trying to keep those tension and you're pressing out into the band the whole time. Okay, so now we're going to quickly go over nerve glide, which sometimes with that kind of gluteal or piriformis syndrome, you have kind of numbness, tingling running down the back of the thigh. So you're going to lay on your back, straighten your left leg, hold behind the right thigh. Then I'm going to dorsiflex or bring my toes and flex my ankle toward me. Then I'm going to straighten my knee just until I feel that like nerve tension up the back of the leg and even down into the calf or the foot. And then if I point the toe, it should kind of relieve it, and then I come back down. So I'm not holding it, I'm just bringing the toes toward me, straighten the knee till I feel it, point the toe, come back down. Just trying to get that nerve to glide and not fully stretching it. One thing I want to add is sometimes that posterior glute pain can be related to SI joint dysfunction or lumbar, like the lower lumbar spine dysfunction of the joints, and those can both refer pain over into that area as well. So it's something to be aware of. Thanks for watching. Please like and subscribe. I would really appreciate it. It helps out the channel.